Let's set aside patient anatomy for a moment and address the topic of physician physiology. What, from the patient's point of view, would you say is a doctor's most important organ or bodily function? Come on now, this is a serious question. My guess is that most professional healers would say that their brains rank first among patient priorities. That makes sense. After all, doctors spend roughly 1/3 of their lives preparing the cerebral cortex for a career in medicine. I can see why. Just the complexities of making accurate diagnoses in difficult cases, for example, can require the most acute memory recall and deductive prowess. On the other hand, surgeons might say hand-eye coordination represents their most valuable physical asset, and they could make a good case. But here's the rub. In scientific studies and from anecdotal evidence, patients don't seem to pay much attention to healthcare providers' brains or hands. Evidently, they get ample reassurance in these realms merely from providers' academic and regulatory credentials. A framed state license and diploma on the wall suffice. Instead, patients generally say that non-clinical skills are usually the most important deal maker or breaker in their choice of providers. One landmark study suggested that 85% of the time, patients change or consider changing doctors due to poor communications. That figure is within a few percentage points of the findings in my own firm's studies of patient complaints about their care in social media and on Rate Your Doctor websites. Therefore, I'd like to propose this rather radical theory. If you ask patients to rank order of importance doctors' own anatomical components in their care, they could quite conceivably say, hold on to your hats, the eyes and that part of the body containing the gluteus maximus muscles. Yes, you heard me right, the butt. To repeat, the doctor's eyes and butt. Wait a minute now, I'm not referring to patients' inappropriately lascivious impulses towards healthcare providers. Rather, the critical point here zeroes in on the perception of those providers' use of their body parts. For this, we turn to a few peer-reviewed scientific studies. From the old news department, studies of patient satisfaction have repeatedly documented the importance of eye contact in physician-patient encounters. For instance, a Northwestern University Feinberg School of Medicine study investigated 110 first-time appointments with patients presenting with cold symptoms. With the help of videotape, the study tracked the percentage of time the providers made eye contact with the patients and then compared it against levels of patient satisfaction based on post-encounter questionnaires. The investigators charted the results to what they call a CARE score. As you can see in this graph, increases in eye contact directly correlated to increases in patients' assessments of their doctor's likability and empathy. No front page news here, folks, but it does make the case that if you want to improve your online reviews by patients, you might start with a touch more meeting of the eyeballs. However, you have to dive a little more deeply to find the really big newsmaker. The Northwestern study found that the effect of eye contact decreased with longer appointments. In other words, shorter physician-patient encounters demand more eye contact. But in today's harried and highly regulated clinical environment, how can doctors find the time to pull that off? In a Stanford University poll published just weeks ago, primary care physicians said that 62% of the time they devoted to patients was spent interacting with electronic health record systems. One more reason to curse the rise of computer tablets in exam rooms. To be sure, EHR devices only hinder eye contact, but man oh man do I have a little trick for you. Here's where we come back to doctors' butts. From the University of Kansas comes research that when physicians sit rather than stand during patient consults, patients' perception of time spent with the doc shifts profoundly. Specifically, on average, doctors who stood during patient encounters in the study stayed for 1 minute and 28 seconds. However, their patients estimated the docs had been there for 3 minutes and 44 seconds, more than twice as long as in reality. In contrast, sitting doctors stayed only an average of 1 minute and 4 seconds, but their patients estimated that they'd lingered there longer than 5 minutes. 5 minutes. Do the math. Sitting allows you to spend 1/3 less time with patients, but creates the illusion that you were with them 1/3 longer. Bingo. Improve patient satisfaction for less effort. That's what I call having the best of both worlds, working smarter, not harder. And there you have it, the odd juxtaposition of body parts at opposite ends of the corpus. It's not getting easier for overworked and overstressed healthcare providers to keep their patients happy. Yet the easiest solution could be as simple as keeping eyes on patients and butts in chairs. Such a coupling of small changes just might make all the difference.